So my name's Gihan Perera. I'm all about leveraging the power of the individual. And my latest book, The Future of Leadership, talks about 9 things that successful leaders do now. And today, I specifically want to talk about the future of healthcare because it's one of those industries that's in every industry is changing very fast, but healthcare is changing particularly fast. So I want to talk about the future of healthcare, and I'm doing it with 3 kinds of people in mind. So you may fall into one or maybe 2 of these categories. So one is that you're just interested as a normal citizen, a consumer, a patient, interested in what's happening in healthcare and some of the advances in technology that are just around the corner or even happening now that will help you with your own health. The second is that you might already be working in healthcare, in which case you might know some of these things, but also it's really interesting to see what's around the corner for you. And the third group is you're not in healthcare, but you might be in business. Either you're running your own business or you're employed within an organization. And it's really interesting to see some of the innovations that are happening in healthcare, and you might be able to see analogies and correlations for your business and your industry as well. And particularly if you're in the second or third group, and I think even if you're in the first, then as you go through the webinar today, do capture your ideas, and you might see some things that you're just going to investigate today or tomorrow. So stop everything. Let's have a look at this right now. There might be other things that you think, okay, a slightly longer term, but in the next couple of weeks you might be looking into them. And there might be things that I hope you don't put off because they're difficult, but you might think of them as a 90-day project that you might take on board. And so, with that to start with, let's get on to what's changing in healthcare. And broadly, if you look at, and this is a very big picture, if you look at what's happening with healthcare, it used to be about curing patients who are sick and who've got, who need acute care or they've got infectious diseases. And so that's what healthcare has been about until now. And the future of healthcare is that we're really looking at, if you go from the bottom to the top, at things like chronic illnesses and conditions, things like diabetes, rather than acute or infectious diseases. We're also looking more at wellness rather than sickness. So we're looking at actual health rather than fixing you when you're wrong. And as we'll see soon, that patients are increasingly acting like consumers. So rather than that doctor-patient relationship where the doctor's the expert and the patient always does what they're told, we're now becoming more like consumers, and we want to have more involvement, we want to have more choice, we want to be better informed, and sometimes we are better informed. And it's all about prevention rather than cure. And you may have seen here at the bottom I've talked about this research, or this idea comes from some research done by Siemens and their prediction about what the future is going to look like. And they've actually written a very, very good report, a very readable report, even if you're not a technical expert and you're not working in healthcare, called Picture the Future. It's about healthcare in Australia. And if you complete the exit survey, I'll send you a link to that where you can download it. You can find it on the Siemens site, but it's not easy to find. So if you'd like a direct link to it, and it really is very interesting, very readable, then just complete the exit survey that you'll get at the end of this webinar, and I'll send you a link to that. It's free, and I'll show you where you can download it from the Siemens website. Okay, now healthcare is such a huge area that there's no way I can possibly cover everything that there is to know, or everything that's happening in every area of healthcare in just half an hour. So I'm going to focus on 3 areas, 3 broad areas, and it's based around something that I've talked about a lot in other webinars and in my keynote presentations. I talk about the world becoming fast, flat, and free. And so we're going to look at healthcare in each of those 3 areas. So what it means by fast is that technology, innovation, and change, so technology and innovation excuse me, are happening faster than ever before. And change, that means that the world's changing faster than ever before. The world being flat means that we've broken down hierarchies. So we've become a lot more customer-centric now, and you may think of today as patient-centric, but as I said earlier, that we are thinking as customers and consumers as well. It's a much more connected world, and it's a much more social world. And also, things have come down in cost a lot because things are digital rather than physical. We're collaborating a lot, particularly online, and automation and computers and software are making things a lot cheaper. And you'll see some examples of this. So I'm going to, as we go through the webinar, I'm going to talk about each of the healthcare in each of those 3 areas. But before we do that, if fast, flat, and free is where we're heading in the future, what's the opposite of that? And whenever I talk to organizations about what's coming up in their future and what might disrupt their business or their industry, we start by looking at what's the opposite of fast, flat, and free. It's slow, bumpy, and expensive. So if there's anything in your business or your industry that's slow, bumpy, and bumpy means that it takes a lot of work to do, and it's quite like it's regulated or licensed or controlled, or it's expensive to do, then those are the sort of things that are ripe for disruption. And in healthcare falls into all those three categories. A lot of healthcare is slow. A lot of it has a lot of paperwork and bureaucracy and forms to fill in, and things take a long time. And healthcare is quite expensive. So I'm going to show you examples of where that's shifting and where some things in healthcare are becoming fast, flat, and free. And this is happening in every industry. It actually happened to mine. In 1997, I started one of Australia's first web design businesses. This is what our website looked like in 1998. So pretty simple, but it was pretty cutting edge at the time. And at that time, web design was slow, bumpy, and expensive. It took a long time to do. The tools they're quite technical, so they weren't simple tools. You needed expertise to do it. So we charge about $5,000 for a typical small business website, and it would take about 3 months. And then, about 5 years ago, I started running these workshops, which were, as you can see, build your website in 2 days. And people would turn up to the workshop, and they would turn up with their laptops, and I'd take them through it, coach them through building their own website, a really professional website in just 2 days. And the cost of that, including the cost of the workshop, was about $1,500. So we've gone from $5,000 to $1,500. And then just 2 months ago, for members of my membership site, and I see some of you are here on this webinar today, I ran a webinar which was build a website in an hour. And in that 1 hour webinar, live in front of their eyes, I built a website from scratch. And the cost of that, so my membership size $50 a month, and the hosting for the website, it's $50 a year on the service that I recommend. So they got that for $100. So we've gone from $5,000 in 3 months to $100 in an hour. So some of the things that you see in your business, your industry, maybe you're charging $5,000 for, and you think there's no way it can possibly be done for less, and it's going to take weeks or months. But sometimes maybe someone will come along and change it so it can be done for $100 in an hour. And there's some examples of that in healthcare. Okay, so let's look at the first one. So the world's become a lot faster, and technology has made the world faster. And I'm going to show you a little bit of healthcare technology a little bit later. But here, I want to specifically focus on how technology has made it faster for us to connect with each other. And in this case, I mean individuals connecting with healthcare professionals. I did, as part of the research for this particular webinar, I interviewed a number of healthcare professionals around Australia. This is one, Bud Ranasinghe, and he's talking about specifically that the technology advances not only help when you're actually in the room or in the hospital, but also the efficient the patient pathway from your visit to your discharge. And he's talking about hospitals, but it also applies to just healthcare in general and talking to your local GP. So Deloitte did some research, and they researched customers, consumers, patients about are they comfortable with using various bits of technology. So I'm going to show you the results from the Deloitte survey, but I thought it might be interesting for us here on this webinar today for me to ask you the same questions that Deloitte asked of their potential customers and patients. So these are questions about how comfortable do you feel with interacting with healthcare professionals using technology rather than in person. You make an appointment, go in and see them face to face. So I've got 4 questions for you, and I'm going to run them as polls. So I'll pop up the poll question, and they're very simple. You just answer yes or no, and I'm going to go through them fairly quickly, and then we'll compare them with the Deloitte examples. Okay, so the first one, do you feel comfortable getting images like X-rays sent to you online? So in other words, emailed to you. You get an X-ray done and you get the images emailed to you rather than you making an appointment to go in and see your doctor. Okay, so people are answering here, and I'm going to make a note of the responses. Good. As I said, I'm going to only keep this open for a very short period of time. So Good. So we've got, and I noticed a couple of people answering in the question box. So don't do that. Do it in the poll on the screen, because then that will help me to see, and everyone will see the results. Then this is anonymous. You don't get to see your answers, but so don't worry about that. But you see the results. Okay. So I'll show you that one. In this one, 93% of people here on the webinar said yes. They're happy with that. Okay, good. Let's go on to the next one. And okay, so what about getting video consultations instead of in-person appointments? So this is your initial appointment. Would you be happy having a Skype or a GoToMeeting consultation with your doctor rather than in person? Okay, so I see most people have voted, 53%, 67%. That's good enough for me. Let's have a look at the results. Okay, 75%. Okay, the next one is how about when you choosing a treatment online? So you go on to your doctor, they come back with the tests or whatever, and they say, here's a range of treatments, Mr. Perera, and there are 3 that you can choose from, and they email you and say, okay, which of these would you choose? And they give you in the email some kind of advice or guidance, of course, but basically you're not actually going in and talking to them. You can have some feedback and talk back and forth, but you're not actually going in and talking to them. Okay, great. Most people have answered, so I'm going to share those results. And that was 70% said yes. And the last one, okay, what about using email and SMS for follow-up rather than having an in-person appointment? Okay, so again, you've gone to see a doctor, and instead of you having to make another appointment, you're going to talk to them by email or SMS. Okay, great. Everyone voted very quickly for that one. So I'll stop that one. So 85% said yes. Okay, good. So let me show you what Deloitte found when they surveyed US customers, consumers, and patients. Now, I know that the people who attended the webinar, it's a little bit self-selecting, because I know that you're interested in the future of healthcare and technology and so on. So the results are going to be a bit skewed, but this is what the Deloitte results showed. That getting images online, things like x-rays, they said about 55% of people were happy to do that. We said 93% in our group. Doing video consultations, we said 75%. And again, US consumers are still way over 50, like 60% of them said yes. Choosing their treatments online, so getting an email or some sort of online information and choosing, again, pretty high, 70%, which is actually what our group said as well. And the last one, which is having email and SMS consultations, we said 85%. The general US population in this survey said 75%. So pretty high, right? So all of these numbers are pretty high. What did the doctors say? So PricewaterhouseCoopers asked doctors why they don't do some of these things, so some of these things like online consultations and email and SMS, and these were their top 5 responses. So 45% of them said they're concerned about patient privacy, security, confidentiality, and that's a real concern. And when I've spoken at healthcare conferences and spoken to doctors, they say, look, we love the idea, but actually regulation doesn't allow us to do this because there's so much concern about privacy and confidentiality. Another large group, 40% of them said this is not part of my job description and I can't bill it, so I don't get paid for doing that sort of stuff, and that's just because the system doesn't allow it. Others say, like 33% or 35% said it's too expensive, not actually to do the Skypes and the SMSs, but too expensive to change their whole practice procedure to allow patients to work that way. Then about the same number said that they didn't actually know enough about it, but maybe if they found out a little bit more about the technology, they might be more open to it. And 25% flatly said, no, this is too hard. So like the technology is too hard to do, so we're not going to do it. Okay, so doctors have got some legitimate reasons for not doing it, but some of them may be just holding on to old ways of doing things. One of the other people I asked, Roshan Weddikkara of St. John of God Hospital in Murdoch in Perth, he works in management, and he made the point that you really need to keep the patients at the center of everything that we do, but also balance the competing interests of everybody else, all the other stakeholders who are involved. So it's not just a case of flicking a switch and announcement saying, now we can do video consultations. You have to get everybody on board and get everybody involved. However, this is going to be the way of the future, and a number of healthcare providers and professionals and organizations are already doing this. Okay, so that's the first area, how you interact with healthcare and how that's changing. The next area is, let's look at how patients are taking control of their healthcare and is becoming more customer-centric, or if you like, more patient-centric. So our health is now in our hands, literally in our hands. At the moment, there are more than 2.5 billion smartphone users in the world, and by 2020 it's going to tip over 6 billion. And that, when we get to that point of 6 billion, there'll be more mobile phones than fixed line phones, and people are using their mobile phones and portable devices for managing their own healthcare. So, for example, let me show you 4 or 5 examples. They're not all mobile phones, but they're examples of where we're taking health as individuals. We're taking our health back into our hands. So, for example, here's one which is used in mental health care. So, this is an app, Ginger.io, which patients with mental health care issues download that to their phone, and it monitors what they do on their phone. So it monitors when they go out of their house and for how long they're out of their house. It monitors when they're actually making phone calls and sending texts. It doesn't actually monitor the words of the texts or the phone calls, but it monitors when they're doing it, for how long they're doing it. And if it falls outside certain parameters, then it warns them. And it also warns their healthcare professional. So the idea is that it monitors what's going on in the patient's life automatically, like behind the scenes, with their permission, but behind the scenes, and automatically alerts them if they see unusual patterns, like people who suddenly stop talking to or talking to anybody, and they see that as a bit of a warning. And the patients themselves can use that to send themselves alerts, but also it alerts the healthcare professionals. And here's another example. This is another app. It's actually a plate. It's called Smart Plate. So you buy a plate and you put a food on it and you take a photo of it with your camera, and the software can actually it can identify the food that you're putting on the plate, and with a combination of the plate's technology and the app. And it can tell you how many calories and what's the content of that. And it can tell the difference between white bread and rye bread, or grilled chicken and fried chicken. So if you're looking after if you're looking after your diet and nutrition, this app can help you do that. And here's another one. This is not an app, but it's a little portable robot that you can get to help you with your weight loss, and it speaks to you. It gives you advice, and it gives you guidance, and it gives you support with your weight loss goals. And it learns. So it learns what sort of things are going to give you help and keep you on track, and it learns which sort of things it says that aren't so useful for you. So that's one of those things that you can now buy. Instead of having a personal trainer or a personal nutritionist or dietitian, you can get this weight loss coach. And what you do with that is you pay a small monthly fee, and she's there all the time and supporting you in that. Okay, here's another example. This is one where Q it's a little personal medical lab. It's this tiny little device that you have at home. You can do many of the tests that otherwise you'd have to go to a pathologist to do. And there are many, many examples of this. This is just one of them. And just the last example in this category, you may have come across 3D printing, where instead of printing on paper, you can have a printer that creates real objects. And 3D printing is being used for printing things like prosthetic limbs. And you can print these for about $50, $50 to $100. You can print a prosthetic arm. There's also, the next step is this e-NABLE social network. So now there's an online network which connects people who need prosthetic limbs with ordinary citizens and consumers who have 3D printers at home, who are willing to print them and connect them up with the people who actually need them. And so that's done without any of the formal healthcare system in the process. So simply ordinary citizens helping other ordinary people, possibly on the other side of the world, with 3D limbs. So this is all about how the we as patients now want to take more control of our own healthcare. If you're in healthcare, I can highly recommend this book, The Patient Will See You Now. Quite a controversial book when it came out, written by a doctor, but talking about this change in healthcare from the doctor being the expert and having all the control to patients now having that sort of control. I've got a couple of other really interesting examples a little bit later on as well. Okay, I'm going to stop and just check if there's any questions, comments, anything that you'd like to ask about anything we've covered so far, and then we'll move on to this third area, which I think is really interesting and exciting in terms of how technology is automating some of the things that that healthcare professionals have done, and in a way that healthcare professionals couldn't even do themselves. Okay, I don't see any questions, so let me continue with this third section. Oh, I do see some. So a couple of questions about any surveys on how doctors see transparency. Philip, can you explain exactly what you mean by transparency? I mean, the people I've spoken to at conferences, their biggest concern is privacy and confidentiality, and that's a huge concern for them. And they feel like their hands are tied because there's nothing they can do about it until the government does something about it. However, you get people who bypass that. I mean, ordinary patients and consumers. For example, with medical tourism, they'll go elsewhere where they can get procedures done by their own choice, where they're not so much hamstrung by by regulations and laws within Australia. Okay, so Philippe says, yeah, doctors don't like to share their know-how and secrets, so to speak. Yeah, absolutely. They want to be in charge. Absolutely. And I reckon that book, The Patient Will See You Now, is really it's a real eye-opener. I think it's very readable, even if you're not in healthcare. But it talks about some of the issues that they want to be in charge, but it's no longer within their control. They don't have that. They don't have exclusive knowledge to that anymore, or exclusive access to that knowledge. And let's look at this third area. In fact, you'll see some examples of how some of the work is being taken out of the experts' hands, and computers are doing that. Okay, so Alex Atkins from Deloitte was talking about, one of the other people I interviewed talked about linking data between siloed groups so you can extract meaning from that. I also want to tell you about this guy, Vinod Khosla. Vinod Khosla is one of those, he's a very smart venture capitalist in the US, and he's one of these guys who's made a huge amount of money by investing very smartly in the past, and now he's got more money than he knows what to do with, and his venture capital company provides a lot of capital investment in healthcare because he figures, well, you might as well use that money to try and help humanity. And he's done a lot of work in healthcare, and particularly with technology companies in healthcare. And he made this kind of bold claim a few years ago where he says that data science and software will do more for medicine than all of the biological sciences together. So it's quite a bold claim, because what he's saying is that the biggest advances in healthcare are not going to come from some lab that's doing research into cure for cancer, but it's going to come from some IT company that's going to be able to use data and software in clever ways. And it was quite a bold claim, but you can see some of that happening now in many areas. So, for example, I use a Fitbit, and I'm sure many people here on the webinar also use Fitbits. And the Fitbit monitors, it tells me that this last week I'm aiming for 10,000 steps a day, and I did almost 13,000. So it's really useful for me, but also Fitbit is collecting all my data, and it has access to data from me and from millions of other people around the world. Now, they're not using that at this stage in any sort of prevention or any sort of interventions. However, they're collecting all this sort of data, and they could if they wanted to. Let me show you some examples that are being used in healthcare. This is one, Zebra Medical for radiologists, where instead of radiologists personally and manually looking at scans and trying to interpret them, those scans get sent off to a software center which looks for patterns. So the software looks for patterns and then reports back to the radiologist. So it takes a lot of their work, takes a lot of time away from them, so they can do the more specialized work. And also the software learns from, like, if it misses something and the radiologist finds out find something that they missed, then the software learns from that, so next time it won't miss it. And again, it's collecting data from millions of people, from millions of scans, so it learns. Here's another one. This is for ENT specialists. Instead of having to buy this expensive equipment now, you can buy this little attachment for your iPhone, and you can do the sort of things that you used to spend tens of thousands, hundreds of thousands of dollars for. And again, the software learns because the information is sent from the iPhone to a monitoring center, diagnosis center, and the software learns over time. Now, some of this learning might be a little bit scary because you collect all this data. In fact, there was this story about Target in the USA a few years ago, Target, the department store, where they sent a teenage girl a catalog of baby products. And her parents were they were enraged by it, and the father stormed into the store, to the Target store, and said, "What are you trying to do? Trying to get my daughter pregnant?" It turned out that she was already pregnant, and Target knew that because her shopping habits had changed, and that was available online. It's not that she was buying baby stuff, but she was buying stuff in there that would help her in the early stages of pregnancy, and the Target software knew about that, and so it started sending catalogs of baby products and maternity products. So now Target have changed their policy now. Not that they don't do that, because they're not saying, "Oh, we respect your privacy and confidentiality." What they do is they send catalogs with general stuff, but with more of a bent towards baby products and maternity products if they detect things like that. So you may not like that, but that's the reality. Here's another example. This is one that I really like, and it demonstrates fast, flat, and free. This is if you've got a heart condition and you need to get ECGs done regularly, then you used to have to go to a doctor to do that. It was expensive and it was intrusive. And now, again, there's a little attachment to your iPhone. You can see someone demonstrating it here, but you can actually do it yourself. You do your own ECG, and you do it once a day for less than $1 a test, and that data gets sent to a monitoring center. And the software, again, learns. And Vinod Khosla has invested in this, and he says in about 10 years' time, the software will be smart enough to make predictions about heart attacks and strokes before they occur, and in ways that humans would never be able to figure out. And even after they look at what the software is predicting, they wouldn't be able to make the same predictions because the software is that smart. Okay, so we've looked at those three areas, and I don't want to make this out to be only about software. Ruth Tarrant, who's another one of the people that I asked, she says the biggest people problem we have is compassion fatigue in clinicians, in doctors, nurses, and it absolutely is. It's a human issue as well. So we can't, as I said earlier, we can't automatically switch to some of the great software that's going to do machine learning and this predictive analysis and big data. That's not going to be an automatic flick a switch, because we still need people in the system. I just want to tell you, one of my clients, Angela Lockwood, who's been a health professional for many years, now as a speaker and consultant, has created this great site called The Place for Health, theplaceforhealth.com.au. So if you are a health professional, then please check it out. Angela's fantastic in that sort of area, in providing resources for health professionals. And on an optimistic note, Emily Scarff, who works in aged care, she talks about the real energy and the motivation and the ideas from young people, young leaders in the healthcare sector, in the aged care sector, and in other areas and that applies to other areas of healthcare as well. And as I said, fill in the exit survey, and I'll send you the link to that Siemens report. Let me quickly check whether people have got questions, because I'd love you to ask questions. Yeah, okay. And Rob says, technology is good, but I run one of the largest health support groups in the nation, and in the over 60 age group, 32%, 1 in 3, do not use a computer or a smartphone. And it's a significant issue for our type of community group. And absolutely, in fact, some of the other people who I didn't quote in the survey today, they said the same thing. They said that one of the challenges is getting everyone to use the technology. And it's not only the patients, it's also the healthcare professionals themselves. And especially organizations and companies who've been in this for a long time, there's a real cost of, it's not that they don't want to do it, but there is a cost to bring in some of this new technology that we talked about. And as I showed you with that survey earlier, that a lot of doctors, they say, okay, we're interested in it, but it's too expensive for us to change our whole practice management to allow that, or we don't know enough about it yet to make it happen. Great. Any other questions or comments? Okay, a couple of people asking about the recording, whether this can be available because it's good material, and absolutely, I'll make the recording available. Good. So just before we finish up, if you've got some ideas, then please share them. I'd love to know what you're going to do. There may be simple ideas that you're going to take and use straight away. There may be 90-day projects that you put into place. And please type that in the question box, and I'll keep them anonymous as I read them out. I'll read them out, but I'll keep them anonymous, if that makes sense. While we're doing that, I'll talk about some of the keynote presentations that I do. The future-proof presentation is the one that I generally do for healthcare professionals and for any industry that's looking at things like this, so wants to know what's around the corner and maybe even what's happening in the world outside their business. Also talk about innovation and collaboration. If you're interested in that, if you're interested in getting your team members to be innovators, because innovation is everybody's business now, then I have a presentation called Bright Sparks. And the other one is for leaders. So if you want to look at the future of leadership and what you need to do as a leader and a manager, then have a look at that one as well. So all of those you can get at gihanperera.com. Let me just, now that I've given you time to actually write some comments. Okay, great. So somebody here said just pre-ordered a smart plate. Fantastic. Really pleased to see. Okay, here's another one. As a designer, I'd like to get involved with healthcare so that all stakeholders can benefit from the new technology. Yeah, and absolutely a better user experience for all. And that's right. And it's not just a user as a patient, but the people who come on board with it throughout the whole healthcare system. There are things that make it better for everybody who's involved. Okay, any other comments or questions? Okay, great. So thank you, everyone. Thank you for coming along. You can find out more about me and what I do at gihanperera.com, and then you can see more about my speaking, the writing, the mentoring, and my membership. I really appreciate you coming along to these webinars. I love running the webinars, telling you a bit about what's coming up in the future. I really appreciate you interacting and taking part as well. The next webinar coming up is called The Big Deal About Big Data. And I've kind of touched on that today because I spoke a little bit about big data with things like the Alivecor and even the target story and the radiology story, but I'll go into that a little bit into more detail and show you how it applies across many industries, probably including your own. If you're live here watching this webinar, then you don't need to do anything. You'll just get the reminders for this automatically. If you're watching the recording of this, then please go to seeingintothefuture.com and register for the webinar series. It's free. I run them monthly, and the next one's coming up on Thursday, the 19th of November. And if you are live on this one and you enjoyed it, then please refer other people to this series as well. Just send them to seeingintothefuture.com. And thank you, everyone, for taking part. Really enjoyed it. Hope you have a great month, and would love to see you back next month for next month's webinar, which is all about big data. Thanks, everyone. Bye for now.